0586861003.
I mean, yoga is such a beautiful way to live life. And when we are talking about yoga and when we are talking about health, health is purely a luxury. A lot of UAE residents have now admitted the fact that there is a struggle for their bedtime routine.
Right.
And doctors are now warning for risks of not having a consistent bedtime pattern. तो आप जल्दी नहीं सोते हैं, आपका अगर clock 9 to 6 का नहीं है, then it becomes a difficult time for you to actually maintain a healthy life, and beyond that, your healthy internal body organs as well. So, to have more details on that, we will be having a doctor, and
डॉक्टर योगेश्वरी हमारे साथ इस वक्त लाइन पे है, स्पेशलिस्ट कार्डियोलॉजिस्ट मेडकेयर रॉयल स्पेशलिटी हॉस्पिटल. गुड मॉर्निंग डॉक्टर योगेश्वरी.
Yeah, lovely morning to all of you. It's really nice talking to you, Nikita and Vivek. Yeah.
thank you, Dr. Yogeeswari. How are you doing?
Yeah, I'm doing really fine because I had a very good night's sleep.
Are very good, very good.
कितने लकी हो आप. हम सबको भी यही चाहिए डॉक्टर योगेश्वरी. We all want this, a good night's sleep. Why is it so important to have a good night's sleep?
Yeah, I mean, firstly, who doesn't, love sleep? Even I love sleep. So sleep is really essential because, it not only helps one to maintain a physical health, but also it has a great impact on one's mental and emotional well-being. So, in fact, it's been referred to as the body's reset button, I would say. And, we've been getting a lot of robust evidences over years. And it's been clearly shown that, if you have a very persistent and accumulative bad sleep hygiene, it clearly increases the risk of heart attacks, strokes, by as much as 30%, which is quite a significant number. So it's really, really important that we have, a good sleep hygiene and a pattern that we need to establish. Yeah.
So, doctor, can you suggest a few techniques where we can start resetting, especially for those who've got this different cycles of morning and evening shifts? How do we get back to our sleep routine? And especially if you are deprived of sleep, then what is the key ways that we can, foster that in our lives back?
Yeah. So it's really, really important. It's a good question that you asked because most of the patients who come to my clinic as well. So whenever I start advising them on lifestyle diseases, why? Because most of the cardiovascular diseases are lifestyle diseases. Like if you can have a good lifestyle practice, 80% of this heart diseases, strokes, everything can be prevented and brought under good control. So having said that, when I start giving them advice, it's very, very important for people to first acknowledge the importance of sleep. Now, we see a lot of people, they start to multitasking, to make their ends meet. And in that process, the first thing that they always do is they actually compromise on their sleep. So it's something very, very wrong, actually. So, small tips that I would want to advise them, especially for those who work on shift basis. Because clearly it's been shown that, for people who consistently work on night shifts, clearly their risk of getting a heart attack or stroke goes really, really high. Now, having said that, the first thing is that see if you can create a routine. Whether you do night shifts or day shifts, you need to create a routine. Like you're going to sleep from this time to this time. And 7 to 9 hours of undisturbed sleep is going to be really, really important. So you cannot overdo things also. Oversleeping also is not good. If that happens, probably you need to consult your healthcare professional as well. But apart from that, some people who are working on night shifts continuously, what happens is something called a circadian rhythm in our body. It's our internal biological clock, actually. So that helps maintain our sleep hormones, our calming hormones, and our stress hormones. So usually during the daytime, the alert hormones are quite active, and during the sleep, the hormones like melatonin are quite active for us to enable to have a good sleep. But in these people, it's completely reset. So what we have to do is, if we cannot, get out of a profession wherein we are forced to continue night shifts, then we can start setting a sleep routine, number one. We can, probably use small things like blockout glasses, blockout curtains, which will give us a feeling of a quiet and an ambient environment for us to have a good sleep. Many of them, what happens in night works, they tend to resort to unhealthy lifestyle. Like they eat junk foods, they smoke to keep themselves, awake all through night, and they eat everything unhealthy. They drink a lot of coffee, actually. So all these things can really, increase the risk of, developing hypertension or, becoming obese or developing eventually heart-related issues. So it's important that they do not resort to all these unhealthy habits, even if they are awake during the night hours. And of course, some patients, they'll be already on certain medications. So it's important to space and time the medications appropriately so that the sleep doesn't really get affected. So all these are small tips, and I really think that will help them a long way, to manage their, work shift schedule. Yeah.
Those are wonderful advice, Dr. Yogeeswari, that you've given. And when you're speaking about lifestyle and you're talking about the whole reset routine, what do you think is the most impactful way that sleep impacts your health? And how does that happen? Is it all only related to lifestyle, or it's also related to, the way we eat? Of course, we do think about the way we eat, but even eating during the evening. So how does really sleep impact your health holistically, if you're speaking?
Yeah. So as I already mentioned, earlier in our conversation, most of the heart related diseases are lifestyle diseases, actually. So having a good lifestyle is going to prevent 80%, 80, it's not 18, 80%. That's a very significant number.
Yeah.
And so I think, I did mention how you need to maintain a good sleep hygiene routine and all those things,
Right.
Avoid junk foods, caffeine, and then all these things. But I think it's very important for us also, as I told you, to acknowledge our sleep, moderation of our sleep. What happens when these stress hormones get released, at times when you're not sleeping well, temporarily if you get exposed to these stress hormones, it's still okay. But then if it gets exposed for a longer period of time, if your body gets exposed to these stress hormones like, cortisol, catecholamines, for a longer period of time, it tends to induce changes in your body. Okay. It causes a lot of inflammation, a lot of abnormal substances get produced in your body, and that can impact your, the blood vessels lining the lining of the blood vessels, and that can predispose to heart attacks, strokes and all those things. So apart from that, supposing you don't have a good night's sleep, and then you get up, you're very irritable, you want to do more, but definitely, your quality of work gets affected. You probably cannot take clear decisions. You will be very foggy. So all these things can lead to, eventually lead to a lower job satisfaction, exhaustion, burnout, and definitely it can take a toll on your mental health as well. So it's not just affecting your physical health, but also your mental health and your emotional well-being. So I think it's really important, and it's, as you rightly said, it has become a non-affordable luxury for many, many spread across all the levels. Yeah.
So, Dr. Yogeeswari, as a specialist cardiologist at Medcare Royal Specialty Hospital, whom do you think are the most vulnerable in terms of the age group who suffer with, the impact of sleep?
Yeah. Usually the ones, if you see the mid-40s, above 40 years of age group, or elderly people, those are already suffering from heart-related issues, actually. So they will be even more prone if their, sleep takes a hit. Now, apart from that, we see a lot of youngsters, as I told you, trying to take multiple responsibilities, multiple jobs to meet their to meet their demands. So it is all these things have to start from a very early age, wherein you set your sleep routine, you make your priorities and all those things. Only then, yes, it's going to help you in the long run as well. Because if you see in UAE, we see a lot of young heart attack patients, and there are no risk factors. And the only risk factor that we could probably identify is a very bad lifestyle or very bad stress that they go through either in their workplace or wherever. So I think it is very, very important for us to have a very good, sleep hygiene established right from a very early age, so that we don't become vulnerable eventually when we hit our mid-40s and 50s. Yeah.
So, doctor, what is your advice for people as a take-home message that they should consider about sleep?
First of all, you have to acknowledge your sleep. There's no shame in acknowledging your sleep. Because, unfortunately, some people are being frowned upon. They say that, they have experienced or they've had a good night's sleep. They are usually frowned upon. You had a good night's sleep, so You could have actually used it in a much more productive way. You could have done this, you could have done that. But that's something that is really not healthy. So it's very important for you to acknowledge your sleep. The second thing is that moderation of sleep, as I told you. 7 to 9 hours of good undisturbed sleep is very, very important. Less than 7 hours is also not good. More than 9 hours is also not good. So if you tend to oversleep, probably you might be suffering from some mood disorders. Probably you might be suffering from some mood disorders or some health ailments. Definitely you need to consult a healthcare professional to make sure that you're not, for example, people who are suffering depression, they probably might tend to oversleep, they might tend to overeat. So it's important that you go and consult a healthcare professional if you feel that you're either not sleeping well or you're probably oversleeping. Okay, so, and as I told you, establish a good sleep health routine, have fixed time hours of sleep, avoid, having the screen time, exposure to these blue lights. Many people, they say that I don't get sleep at all and therefore I, sit and look at the TV. But then watching at TV, exposure to all this blue lights definitely will, delay the onset of your sleep. So all that is not good. And you need to have a very good physical activity. Having said that, it's important that you don't overtrain yourself just before sleep and heat up your body too much. So that is also there. And I think all these small issues will go a long way in, impacting one's health overall. Yeah.
Dr. Yogeeswari, wonderful having you, and your tips are really vital for all of us. Thank you for sharing all that and more about sleep and the deprivation of sleep that is there, and considering it as a vital part of our lives and giving importance to sleep today. And also touching upon that sleep taboo that people actually give to others who sleep for 7 to 9 hours. Wonderful having you, Dr. Yogeeswari, on our show.
Thanks a lot. Yeah. Bye.
Bye-bye. Have a good day.
From Talk 100.3.
Welcome, Insurance Market Metro Station. Yes, we're officially your favourite stop on Shakeside Road. We are taking